So we just talked about childhood nutrition with a special focus on the division of responsibility. As I think I made clear, this is a subject that I strongly recommend that you become very familiar with. It provides a very practical model that promotes healthy, lifelong behavior, a sure way to take a positive step in parenting. Now we're going to fast forward way forward, and we're going to discuss nutrition for older adults. For this, we're going to look at the different calorie and protein needs for older adults. The changes are not huge, but they are significant, and it's especially interesting to look at the decreasing calorie needs and increasing micronutrient needs and the problems that that presents. And then from there, we're going to move on to more specialized dietary considerations, such as nutrition for pressure ulcers, nutrition with swallowing difficulties, micronutrients of concern, specifically for older adults. And then we'll also look at very briefly the link between nutrition and Alzheimer's disease and dementia.
There's lots that's going to go on in our body as we age. There's a lot that's going to go on in the aging process that is linked specifically to our nutritional status. So the first thing is we are more likely to have a decrease in lean body mass. We're just going to burn through and break down more protein. Our sensation of taste is decreased. We have less stomach acid that's produced. Bone loss, just like muscle, is broken down more quickly, and we have increased difficulty managing activities of daily living. All these are linked to nutritional status. Being underweight has a new meaning for older adults. That is going to increase their susceptibility to the detrimental effects of chronic disease. And what research shows is that there is a very strong link between being underweight and a more rapid physical and cognitive decline in older populations. There's also an increased risk for bone fractures and from that mortality. So what you see is that older adults that have hip fractures, once they're at a certain age, around I believe 75 or 80, if they have hip fractures, um, they're a lot less likely to recover from that. And having low body fat stores and low muscle protein increases their susceptibility to those fractures. So it's very important that we prevent those as much as we possibly can to ensure high quality of life and also overall increased lifespan. So for that reason, BMI takes on a different meaning for older adults. A body mass index between 18.5 and 25 is generally considered a healthy BMI for most adults. For older adults, this jumps way up to where the lower limit is around 23 and the higher limit is 33. Understand that normally for most adults, a BMI over 30 indicates obesity. But 30 to 33, that BMI for seniors can actually be considered a healthy body weight. So it's important for seniors to have a little bit extra body fat. You obviously don't want an excess amount because that is going to increase their risk for lots of chronic diseases. But having more body fat is better than less for older adults. Activities of daily living are strongly influenced by overall health and nutritional status. We won't really focus on that on this slide. We'll talk about that in slides after this. But the point of this is to highlight what activities of daily living are, just to introduce that topic. So the basic definition of ADLs are activities that are related to our ability to live and operate independently. These include very simple things like eating, getting access to food, bathing, getting dressed, toileting, moving from one place to the other. Things that a lot of times people that are younger, they don't even consider being something that could be impaired. But for older adults, eating and getting access to food, that can be something that they may need assistance with. When I worked with the Council of Aging in southern Wisconsin, there was one gentleman that we worked with who was only eating 1 can of tuna per day because he just had such a limited access to the grocery store. He had to really conserve his supplies and was eating very, very minimally. Fortunately, we were able to get him meals, and there's lots of programs that are available for seniors in the United States, but there's a lot of seniors that don't take advantage of them. And the activities of daily living, these can be significantly affected by our weight and nutritional status. As we get older, our rate of muscle breakdown is quicker, and so we're less likely to hang on to lean body mass and we're more likely to store body fat. The problems with that are, number one, that itself, a decreased amount of lean body mass and decreased amount of muscle tissue is going to result in slower metabolism. If we have more muscle, just having that extra muscle burns more calories. If we lose that muscle, then our metabolic rate is also going to decrease. It does require some calories to maintain fat, but that's a lot less than the amount of calories required to maintain that exact same amount of muscle. And the second problem that's linked to the rate of muscle breakdown being quicker in older adults is that if we have more muscle, we have more power and we have more strength. And when that gets decreased, that's going to start affecting our ability to perform activities of daily living. So in that last slide, there was a picture of somebody that's climbing mountains. Obviously, that's not going to be an activity of daily living. The more basic things that are discussed on the left side of the page, those are. But it's worth realizing that the things that we love to do, on top of just those basic things, that's going to be impaired by a decrease in muscle tissue. So there's a lot of physical and from that psychological effects that occur from that loss of muscle and the inability to perform very basic functions. How do older adults combat this? Number one, they need more protein. So if they consume more protein, then they're less likely to lose as much muscle tissue. Dietary protein is going to convert right into our muscles. Most adults, if they're not active, are going to require 0.8 grams of protein per kilogram of body weight. For older adults, this is going to increase significantly from 0.8 to 1.0 to 1.2 grams per kilogram. So what this means is, say we have a 35-year-old adult that's sedentary, they're going to need about 55 grams of protein per day, whereas a senior at that exact same weight is going to need about 68 to 82 grams. So quite a bit more. On top of that, older adults should be engaging in regular physical activity. Weight-bearing exercise is going to help maintain muscle tissue. This actually also is going to increase our bone density, which in addition to having more muscle tissue, having greater bone density is doubly going to help prevent against fractures. Exercise that older adults do can be moderate and mild. It actually should be not intensive. And so ideal activities that would be weight bearing and increase strength and increase lean body mass, or at least prevent further or significant breakdown of that, would be simple things like walking, biking, hiking, lightweight lifting, aerobics classes, and swimming. And it's more important that you enjoy it and that you're consistent with it and that you're doing something that is sustainable and that you're very rigid and strict with it. Also, regular exercise is going to help to boost appetite, and hopefully with that, that will increase the intake of protein. A couple ways to ensure adequate calorie and protein intake. for people that have lost taste would be to make sure that they get 3 regular meals per day, and they can throw in some protein-rich snacks as well. Soft protein foods like yogurt and cottage cheese, lunch meat. Those are great options, great ways to get extra calories and some protein. Um, Getting sources of fat like olive oil, whole fat milk, peanut butter, using those things liberally. And then you could use something like protein drinks. Shouldn't rely too heavily on this, but things like Boost or drinks that have protein powder that are added to them, Premier Protein, Ensure, those are all beneficial ways to add a little bit extra to someone's dietary intake, especially after a meal or later on in the day. As we get older, the amount of bone that we have is going to increase up until the point where we're around 30, and then around 40, we're going to see a fairly steady drop. For females, around 50 or 60, this drop is going to be a lot sharper, right around the menopause period. But there's going to be a decreasing amount of bone mass that occurs as we get older and older. And so, like we talked about before, that's why it's really important to get regular exercise, get regular protein intake, and then also get adequate intakes of calcium, because calcium is a component of the bone. We're going to move on to a less well-known older adult nutrition topic, and this is called pressure ulcers. And what these are, these occur from tissue damage that's caused by pressure on a bony prominence on the body. It's caused by a lack of mobility and being in a fixed position where you're getting pressure up against one of those bony prominences for long periods of time. And you can see some common areas where these might occur. Most frequently, you're going to see these in the lower back and in the buttocks. You might also see it in the hip, around the legs, in the lower extremities, especially for people who have diabetes. And it's something that it seems like it would be pretty easy to detect early on, and that this really shouldn't be a factor in too high of a degree. But in the nursing homes that I've worked at, we've always seen about 5 to 10 of the patients at any given time out of about 80 to 90 total patients that had pressure ulcers. And some of them would be very serious and very painful. You typically see pressure ulcers occur in people that have a combination of the risk factors that are outlined below, people that are mobile and have difficult time adjusting themselves or moving around, in older adults who have difficulty controlling their bladder and bowels, where they can have excess moisture accumulate and stay there for long periods of time, older adults that have difficulty communicating, and it's also common in older adults that have diseases that limit blood flow, such as diabetes, because that quicker blood flow, that more natural, normal blood flow, allows nutrients to move throughout the body. But if you have an injury site and then you're not getting adequate blood flow to that area, then what's more likely to happen is that pressure ulcer is going to take a lot longer of a time to heal. So for people that are diabetics, generally recommend controlling their blood sugar first before we do anything else to help that healing process occur. And you'll largely see those pressure ulcers occur in lower extremities, the ones for diabetics, especially in the toes and in the foot. There's different stages of pressure ulcers. Stage 1 is just a blister. Stage 2 gets a little bit deeper. Stage 3, it's very deep, and then stage 4 gets to the point all the way where you're at the bone. So bone is exposed to air. Stage 3 and 4 are fairly uncommon, but they do still happen. At the places I've worked at, I've seen it with some relative frequency. So first and foremost, people that have diabetes, that have pressure ulcers, they need to manage their blood sugar levels so that they can get adequate blood flow to that site of injury so that it can heal. Then wound healing vitamins and minerals, especially the antioxidants. Having adequate intake or extra intake of those will help. And then we have to get more protein. And the higher the stage, the more protein we're going to need. Older adults are also at an increased risk for swallowing difficulty. This is known as dysphagia. And the problem with this is that it can cause coughing or choking on foods and fluids. And this is often caused by a weakened esophagus or a compromised esophagus. It's common in neurological disorders such as stroke, and it occurs with general aging, especially in cases of malnutrition and inadequate calorie and protein intake for extended periods of time. With that, you tend to see a weakened and a broken down esophagus, so that the movement of peristalsis that typically gets things going through the esophagus isn't quite as effective, and food is more likely to get stuck in certain areas, specifically in the lungs. One of the most, if not the most significant risk that's related to dysphagia and difficulty swallowing is aspiration pneumonia. Aspiration is simply the breathing of foreign objects into airways. In this case, we're talking about food. Aspiration pneumonia is a very severe lung infection that occurs when food enters the lungs. And this can cause some scarring to the esophagus, and it can cause respiratory failure, which can lead to death. The goal is to catch swallowing difficulty in its earlier stages and then have a speech therapist evaluate this person, and they can determine what type of texture of food and fluids this person should be getting. And there's going to be different stages of dysphagia. In severe cases, you can't get any nutrition by mouth, but in most cases you can at least get some food in, just the texture has to be modified to some degree. So you have a few different levels. You have soft, you have minced and moist or mechanical soft, and then you have smooth pureed. Soft is generally just chopping up tougher foods into cube-sized pieces and then adding lots of sauces and things to help make that food go down a little bit more smoothly. The mechanical soft, or the texture B, what you're doing is you're grinding a lot of textures, maybe not into a puree, but you're grinding them into little tiny pieces, and then also adding sauces and things to moisten the food. And then in later stages of dysphagia, where it's more advanced and swallowing difficulty is pretty extreme, the person can only have pureed foods, where everything that they consume is pureed. This is oftentimes not very appetizing, so the person has to add a lot of protein supplements to their diet. But you can also throw on lots of gravies and sauces to make the food that's pureed more enjoyable and more tasty. Liquid textures are also evaluated, and you have a few different levels, just like you do for the different types of foods. So all liquids that a person with dysphagia that requires liquid modifications, all liquids that they consume are modified into these three levels. You have nectar, honey, and spoon thick. Nectar is runny, but still has some thickness to it. Spoon thick is almost like pudding. And this is for liquids. So imagine having to drink water that's in that type of form. Like we mentioned on the last slide, if a person is having very severe dysphagia, they may not be able to take in anything through their mouth, in which case they'll generally have a tube that is connected directly through their stomach, and you're going to pump in a tube feed formula that is going to provide all the person's nutrition and hydration needs. The last topic that we're going to look at is the link between nutrition and dementia and Alzheimer's disease. Now, the causes of dementia and Alzheimer's are not 100% certain, but there's a lot of research that suggests that there is a link between these conditions and inflammation. And inflammation is caused by something that's known as free radicals, and that's going to damage cells and on a larger scale tissues. We'll talk about more what that looks like on the next slide. Whenever we're exposed to or consume chemicals that our body is not designed to handle, like pollution, excess alcohol intake, illicit drugs, very processed foods or foods with large amounts of sugar, our body is going to create this inflammatory response. And inflammation is going to create free radicals. All that is just we have one electron that is going to be unpaired. That unpairing of that one electron is going to alter the structure and the function of cells. And so the more of those that you have, the less likely that the cells in your body, specifically have a certain tissue or organ, are going to function optimally. So from a brain or a mental standpoint, because whenever we have inflammation that occurs from food, there will be an inflammatory response that occurs in our brain. Over the short term, high levels of inflammation are going to cause effects on our mood and our thought processes. And this will take the form of increased irritability, difficulty concentrating, depression and anxiety. Also, people that have PTSD, schizophrenia, schizoaffective disorder, bipolar disorder, and many other forms of psychoses, they're more likely to have stronger symptoms of these conditions when they have higher levels of inflammation in their brains. Now, over time, to other organs in the body, over time, the damaged cells can adversely affect their function. And so inflammation that occurs regularly over a long period of time is linked to causing diabetes, heart disease, kidney disease, and even potentially dementia and Alzheimer's, because it can break down the structure and therefore the function of our brain. Like we mentioned on the last slide, the inflammatory foods are the ones that are highly processed. Generally, they're just junk foods, but specifically this includes foods with lots of added sugars, meats that have nitrates that are added to them, fried foods, monosodium glutamate, and excess intake of alcohol. It's important to understand that we can still have these foods if we're trying to prevent against dementia and Alzheimer's. It's just very important that we limit and control the amount of these foods that we have. So maybe having a couple of these foods in very small quantities throughout the day, that's okay. But eating just these foods and not lots of natural foods, that would be bad, and that would be linked to an increased risk of dementia and Alzheimer's. So what can we do with our nutrition to optimize our cognitive processes and prevent against the progression of dementia and Alzheimer's? Mainly, it's going to be through eating lots of foods with antioxidants in them and omega-3 fatty acids. Omega-3s help to build brain cells and connections. And so healthy fats like olive oil, fish, nuts, peanut butter, seeds, and avocados are good sources of this. Antioxidants can help to heal those damaged or inflamed brain cells. They are able to donate an electron to a free radical, which effectively heals a free radical and over time can help heal damaged cells and even slightly damaged organs. And we get antioxidants through intakes of large amounts of fruits and especially vegetables. With all this, the nutrition problem for older adults largely boils down to the fact that they have a slower metabolism, and so they have decreased calorie needs. However, they need micronutrients, certain micronutrients in larger quantities, and they need increased amounts of protein due to the extra muscle and tissue breakdown that they're going through. So we have to be especially careful with nutrient density and make sure to emphasize that, and make sure the calories that older adults do get, make sure that they count. So that's the big nutrition problem for older adults. We just can't stuff them with sugar and fat. We have to figure out ways to get protein in them and then lots of vitamins and minerals to optimize their nutritional and overall health status.